Hello everyone and welcome to VJOncology series to try to do a summary of what has been presented at this ESMO 2020 meeting. At this time we are going to talk about what has been the most important and most relevant abstract reported in the genitourinary field. In bladder cancer we have two main phase III trials that were released for the first time. The DANUBE trial, a phase III trial that compared the combination of durvalumab and tremelimumab versus single-agent durvalumab versus standard chemotherapy as a first-line treatment, and the KEYNOTE-361 trial, once again with 3 arms of treatment, pembrolizumab as a single agent or the combination of chemotherapy plus pembrolizumab or chemotherapy as a control arm. Unfortunately, both trials failed in the primary endpoint of overall survival. Unfortunately, none of these new combinations, did add any benefit upon chemotherapy on this field. We need to keep on doing research and we need to keep on selecting the right patients to receive these novel combinations. In the field of kidney cancer, Professor Genitourinary presented the Phase III trial CheckMate 9er. The CheckMate 9er is a phase III trial comparing the former standard of care, sunitinib, versus the combination of nivolumab and cabozantinib. CheckMate 9er, the combination of nivolumab and cabozantinib, offered for a better response rate, progression-free, and overall survival. So it seems that nivolumab and cabozantinib is becoming a new reference standard of care together with pembrolizumab, axitinib, nivolumab, ipilimumab, and avelumab, axitinib in this field. Finally, in the prostate cancer field, 2 new phase III trials were presented. The PROfound trial, that was already presented at the presidential session at last ESMO meeting, updated the results in overall survival. Dr. Johan de Bono shows that the overall survival was met, and those patients with DNA repairing genes alterations who were treated with olaparib did it better for overall survival than the standard treatment with enzalutamide or abiraterone. In addition, and finally, the last trial was the Hypatensia 150. The Hypatensia 150 trial is a phase III trial that compared abiraterone versus the combination of abiraterone plus ipatasertib. Ipatasertib is a novel PI3K/AKT inhibitor, which in those patients with PTEN alterations, most of them PTEN deletions, offer for an improvement in progression-free survival. Unfortunately, no difference at all at this time with the current follow-up was observed for median overall survival. This is remarkable and very interesting from the scientific perspective that if we select patients for according to NGS alterations in the PTEN gene, the hazard ratio was even better for those patients for terms of progression-free survival. So it seems that the precision medicine is coming and is arriving to the field of prostate cancer, and now we have 2 molecular biomarkers to offer to our patients, DNA repairing genes and PTEN deletions. Let's see if the data are enough robust to convince the health authorities to approve these kind of approaches.